Hi everyone, my name's Alex, and for my virus, bacteria, fungus, disease of the day, I chose tetanus, and I'm going to be giving a comprehensive overview of the causes, prevention, and epidemiology behind it. I'll start with the introduction to tetanus. To contract tetanus, someone must be infected with the Clostridium tetani bacteria through a cut or a wound that has contracted soil or feces or dirt or anything like that. I should note there that any cut or wound, it's usually going to be more of a deeper cut or deeper puncture wound, not like something like superficial or anything like that. The main reservoirs for tetanus are soil, dust, manure, along the same lines as like dirt, soil, feces, where it can get infected or contaminated through. And just also noted, the toxin in the tetanus bacteria can actually cause what is known as lockjaw or maxillary spasms. So that's where your lower jawbone will lock up and your muscles in your lower jaw will stop moving and your jaw is locked in place, can't open it, move it whatsoever. So it feels like you have a lock on your mouth. The consequences of the infection. Some symptoms, to be more specific. Tetanus should be noted that it can be completely prevented with a shot. It should be a part of your normal round of immunizations as a child, and once you become an adult, you can get the booster shot just once every 10 years and you'll be completely okay. However, if one is infected with tetanus, they could experience things as far as respiratory distress, arrhythmias, or even pulmonary embolism. Additional long-term complications can include breathing issues, swallowing issues, as well as some memory problems. Some relevant epidemiologic statistics. Tetanus is really, it's due to the nature of it, if it can be contracted, it can become really fatal really fast. It's a super closely surveilled disease in the US, with the CDC reporting less than 2 deaths per year from tetanus every year since 2000. So those are some positive trends that we like to see. Low death rates, low mortality rates with the disease. And actually, in a CDC study with 267 cases in the US, 13 deaths were observed from 2013 to 2022, with only 16 of those 267 cases having had the vaccine or 3 or more times. So that kind of might indicate that there might need to be some improvements in the awareness for people to get out there and get the shot and keep themselves or like their loved ones safe and just keep those death rates really down, because 2 deaths per year is a very very healthy rate for a disease that could be really deadly like this. Here's some more statistics. U.S. reported tetanus cases from 1947 to 2023. You can see starts out super high, and then as soon as modern medicine starts to improve, better vaccines, use of TIG vaccines, other toxin flushers, everything else, modern medicine continues to improve over the years, and now we're at 2023 where it stops. And like my previous data noted, we're down to less than 2 cases reported per year. Some field prevention for the disease. To prevent it from evolving, you should really focus on making sure to wash your hands first, no matter what, before touching anything that could be infected already, and also clean dirt and debris, anything that might have the tetanus bacteria on it. Get that immediately out of your wound. Anything, no matter how deep it is, get all of it out. That's a critical part. And seeking proper medical attention as soon as possible for better, extensive, and more monitoring. And medical professionals will just have a lot more resources at a place like a hospital to be able to discharge you, or just give you some kind of diagnosis, whether it be further care or medication, prescription, all that. Some more clinical treatment if the disease does start to evolve more. Tetanus infection is one that does not provide immunity to its victims, so for future prevention, it's usually recommended to get the shot and continue to keep up with those every 10-year boosters. And if you do contract the disease, say out in the field or whatever, something like that, medical experts recommend at a hospital 500 IUs of TIG for tetanus treatments to flush all the toxins and bacteria out of your system. And sedatives should be used for muscle spasms. Depending on the level of pulmonary distress, if you're starting to get muscle spasms in your chest and in your lungs and your pleural muscles, then intubation may be warranted in some cases, but that's usually an extreme measure for most cases. And here's my works cited, and that's it. I appreciate everybody for listening, and hopefully everybody learned something new today. Thank you.